So, as we have discussed earlier in the classes for your forward extension poses, the forward bending, that is the seated category that we are going to talk about. In the last class we have discussed, or in the earlier class we have discussed about the Janu Asana. So today we are going to talk about the pose. Yes, the name is a little bit difficult, but we try to make it simple for you guys. So the name of the pose is the Tranga Mukha Ekpada Paschimottanasana. 3 limb facing single leg forward bend. Right? The 3 limb facing single leg forward bend. So Tranga is for the 3 limb. Tranga Mukha Ekpada Paschimottanasana. So 3 limb facing single leg forward bend. So in this pose, yes, little bit difficult with the name, but if you try to practice it, it is easy because we are getting into the intervals. Break the pose, break into the components. So Tranga Mukha Ekpada Paschimottanasana. 3 limb facing single leg forward bend. So Mr. Shobit is here with me once again to demonstrate this pose. So just try to face this side, Mr. Shobit. Come to the seated forward extension first. Spine straight, pelvic neutral, first and foremost thing. If you revise now, if the pelvis is going back, problem. No solution is there. As we have discussed in the earlier 2 poses, how to correct the pelvis, now you know guys, right? So you have to adjust your client according to that way. If the pelvis is going forward, hunchback, rounded shoulders, try to create balance here first. Starting with neutral pelvis, 1 line alignment. Always remember in your mind that center of the hip, center of the knee, center of the ankle, 1 line, spine 1 line, neck in 1 line, not going forward and bend. Now, come to the pose, brother. So bend this knee first, then next component, take it slightly backwards. Here, what the problem can happen? Knee pain. Isn't it? Sometimes people have knee injuries, avoid this pose. Right? Avoid this pose. We have to avoid it. If the person has not that much serious knee injury, we can practice this pose, but with the modification. First and foremost, we have to just straighten your knee first, brother. So never take the student in this way that your knees bend and you're trying to lift up the pelvis. No. Extend the knee. Knee has limited amount of movement, limited amount of flexibility, flexion, extension. So be careful in this pose with the knee joint, my dear friends. So again, I'm going to my student, this cushion here. If the knee is getting more painful, not able to do it into the final pose, then again we can do it, just bend your knee. That's it. One variation I'm telling you, if the person who has knee injuries, this variation. If the person is able to do, you can, possible? Here we can do. If the pressure is coming to the knee here, use the cushion. Is it better? So this way we can do. Here you can use also roll mat, but it creates sometimes compression. So we don't have to create extra pressure. It's better to use it here. Or the another way which I have showed you, just no need to bend it completely backwards. Just flex your knee to 45 to 60 degrees. Next position now. Pelvic roll forward. Hands up, bend forward. Modifications, you know, if you are not able to reach, again we are introducing a chair here. Make sure that it's not going one side. If it is going one side, use any cushion here or use any cushion here. It's neutral. You can bend it forward again, slightly more. Use the chair more down now. Use the railing which is down, the angle of the chair. Rest your head if you want. Hold it here. Knee pain, hip pain. Too much. Modifications here. Release the pose. We can remove the chair again. Sorry. Here we can use the next thing. You can use the strap to the same way which we have used earlier. But make sure, make your heart forward, bring it forward, extend your spine, no need to drop your head, look at your eye level. Pelvic neutral on the both side, no upliftment on one side and the other side too. Right? If you have to able to reach more forward, use the block here, hold it. Avoid the compression. Stretching, equal stretching on the both side of your spinal column. This way we can use it. Advanced level, we can remove the block from here. Now again come to the pose. Extend your spine. Always extend, not with the forward fold spine. You can drop your head if you are comfortable. So hold the poses like this way. Pelvic neutral here. Spine has to be getting, not shifting on the one side slightly. It has to be balanced and increase the range of motion. Make sure, try to release extra pressure from the knee joint. Right? The excessive pressure from the knee joint. Otherwise, the knee will hurt more. If any previous knee injuries, any previous hip injuries, or any knee surgery or hip surgery is there, avoid this pose. Any problem with the spinal column like disc herniation, sciatica you have, avoid this pose. So this pose is more intense, that will give you the more intense stretch to your muscles, increases more blood circulation, and create compression and relaxation effect on your hip joint too. So that will increase more nutrition to your hip joint area, that is around the joint which we have formed, we have discussed on the hip anatomy, that acetabulum and the head of the femur where it connects. You can come out of the pose. So these are the modifications. Slightly how to come out of the pose. Now slightly straighten your knee, brother. So take the help of your other hand and bring it to the extension. So make sure, guys, that any ligament injury you have on your knees, avoid it, guys. Any hip ligament injury, avoid it. Because sometimes there is unequal weight bearing on the knee which we have bent, and there is more chances that the compression on the meniscus and tearing of the ligaments here too. So this is the pose, good pose, but according to the need of the student, according to the level of the flexibility, we have to go step by step. It doesn't mean we have to force it. If my client is not able to get into this pose like this way, I'm happy with this only, the previous pose which we have discussed. So no need to go that much forward. This is the advanced pose where you can engage the muscle of your knee joint and the muscle of the hip joint too. So this is the good pose for the varicose veins also, which gives you the more compression effect on the left side. If you repeat it on the other side, it gets balanced too. So it can create the pressure on your veins to get the blood circulation back to your heart. But the main issue is the knee injuries, hip injuries. And also no need to try overstretch your ankles like this. This is wrong. If the ankle injury in relation to the ligaments, avoid the pose. So these some intense benefits you can gain from this pose, but if there are limitations, any pre-existing history of the injuries, avoid it. So only try if you know that I am able to do it, my client is able to do it, there is no pre-existing history, and there is a strength and the flexibility on my back spinal muscles and the strength on my knee muscles, then only try to do it. So try this pose, but with more cautions, with more preserved techniques, with more preventions. So it's not need to force. So feel this pose, feel the intense stretch. All the modification we have to use, blocks, belt, chair, your partner you can use. If there is no chair, you can hold your partner. So you can hold my pelvis and just try to stretch. That way also you can help your student. Right? To get some extra stretch on the spinal column. So I hope, guys, this must be clear to you, the pose. So try it, get the benefits, be careful, Any questions, any queries you have, we are here to discuss with you. You are always welcome. So try this intense pose, intense stretch, but be careful. Till then, namaste. Have a nice day.